Hi, Jan Shimano here. I'm talking today about heart disease and various risk factors that are involved. Now, there are some risk factors that we can't do anything about, and yet there are others that we can do something about so that we can improve our chances of not getting a heart disease. But first of all, I want to mention the 5 risk factors that there really isn't anything that we can do about. The first is that of age. Now, 85% of all people that die of coronary heart disease are age 65 or over. The second risk factor that we can't do anything about is that of gender. And in this case, it's the male gender that is at more risk for heart disease than the woman. More men die of heart disease than women do, and the men die at a younger age as well. Now, women, even after the menopause, still don't have as many deaths related to coronary heart disease as do men. The third one is that of heredity and family history. Now, if your parents died from heart disease prior to the age of 55, then you are at a greater risk of having heart disease yourself. Another one is that of congenital risks and any inherited problems that you might have, or if you've got some genetic abnormalities, then that could also give you an increased risk for heart disease. And the fifth one is that of menopause. Now, prior to menopause, women are protected by the hormone levels that their body produces. But after menopause, those levels greatly decrease, and along with that, the protection decreases. And of course, that's something that women can't control. The menopause is going to come regardless. But now, there is some good news. There are 3 major risk factors for heart disease that we can do something about. These 3 are high blood pressure, diabetes, and high blood cholesterol. And in every one of these cases, there is wonderful medical treatment that can certainly control these particular things. So what you really have to do is make sure that you take the medication that your doctor is prescribing, because if you don't, then you are going to continue to be at risk for heart disease. So when you know that you can improve your chances of not getting heart disease, then certainly it would be foolish not to do something about it. So they're the 5 risks that you can't do anything about, the 3 risks that you can, and I hope you found this information informative, and until next time, I'll say goodbye.